The press conference with Minister Motegi will start. Player Otani's game was thrilling. Toward the end, it was a bit unfortunate. There are 3 opening remarks to make. First, about last 1 mile support, as well as about vaccines. So far, Japan has provided AstraZeneca COVID-19 vaccines to 5 Southeast Asian countries and economies, including Taiwan. This time, as a result of our review upon request for additional provision of vaccines from Japan, we have made a decision to supply additional 1 million doses to Indonesia, Vietnam, and Taiwan. These vaccines are scheduled to be shipped to these countries and region on July the 15th. As to the vaccine supply via COVAX, as of July 9th, AstraZeneca vaccines made in Japan were included in WHO's emergency use list, so that as soon as the preparations for shipments are completed, a total of 11 million doses of these vaccines from Japan will be supplied via COVAX. We are coordinating with the relevant institutions to that end as we speak. Once coordinations are complete, these vaccine supplies will go to Cambodia, Laos, East Timor, Bangladesh, the Maldives, Nepal, Sri Lanka, Fiji, Kiribati, Papua New Guinea, Samoa, the Solomon Islands, Tonga, Vanuatu, and Iran. Japan is also providing the last 1 mile support to deliver vaccines to the vaccination sites. On top of the support we have been providing via UNICEF, since June, we have been extending a total of 4 billion yen of bilateral assistance via JICA. So far, we have decided to grant such support to Ghana, Senegal, Mozambique, Malawi, and Palestine. Just last week, decisions were made to provide assistance to the Philippines and Mongolia as well. When all of these are included, Japan's contribution in terms of the last 1 mile will amount to 13.7 billion yen for 59 countries and regions.
The second point is concerning the start of reservations for vaccination of Japanese nationals residing overseas to come back to Japan temporarily. On June 25th, there was an announcement concerning the vaccination program for Japanese nationals living overseas. And from July 19th, reservations will start via internet. And at the same time, the Ministry of Foreign Affairs Overseas Travel Safety Information top page, there will be a link to a special site that will be displayed. So those who desire to be vaccinated according to this program, we do hope that they will make prior reservations through this special site. From August 1st, the vaccination will start, and we are anticipating early January to be the ending date. And for the time being, from the date of access, our reservations up to 2 months in advance will be possible. And the application for the vaccination certificate in each of the local municipalities will start July 26th. And therefore, those people living overseas who wish to come back to Japan temporarily for vaccination as necessary, they can apply to the MOFA site, and the vaccination certificate will be issued. The details will be uploaded on the MOFA Overseas Travel Safety Information webpage, so please confirm.
Lastly, about our support to Myanmar. Since the coup d'etat in February in the south-eastern region of Myanmar, food and daily necessities are running short, and humanitarian situation has deteriorated rapidly. Due to many clashes between the armed forces of ethnic minorities and the National Army of Myanmar, the number of domestic refugees has also surged. In view of this situation, today we made a decision to extend $5.8 million of emergency grant in aid via international institutions, including UNICEF, as aid for people affected by the coup d'etat in the southeast of Myanmar. Including this, since the eruption of the coup d'etat in February, we will have provided a total of $20.89 million of humanitarian aid to Myanmar. Japan's government intends to continue to extend assistance to the people of Myanmar in consideration of their needs. That would be all.
So those of you who have questions, please raise your hand. Once you're designated, come to the stand mic and state your name and affiliation before you ask your question. Thank you. Yoon from JTBC. Well, yesterday, from the World Heritage Committee of UNESCO concerning the industrial Meiji Industrial Resolution heritage concerning Hashin. And also they made a promise that they will be protecting the victims. However, that was not implemented. And concerning this decision, I would like to ask about the views of the Japanese government. Now, concerning the resolution as well as the report from 16th to 31st this month, the World Heritage Committee will be held, and we understand that that is going to be discussed there. So this is going forward at this point in time. I would like to refrain from commenting. And based on that, in Japan, concerning the recommendations and resolutions by the World Heritage Committee, we have accepted these, and what inclusive what the government has committed to, we have been faithfully implementing this. So we would like to respond appropriately.
Tomita-san, go ahead. If it's the same question, please continue. So, in Shinjuku Ward, there's Industrial Heritage Information Center. Do you have any views to consider changing the exhibits there? Well, as I said, please listen to me carefully. At the outset, what did I say? The draft resolution and the report from the World Heritage Committee between the 16th and the 31st of this month, the UNESCO World Heritage Committee will meet and take these issues up. And at this moment, I would like to refrain from making comments, as I said. So at this moment, I would like to refrain from making comments, as I said. Tomita from Nikkei. In Indonesia, there's infection ongoing. I would like to ask a question. So the status of infection among the Japanese nationals living in Indonesia, what is the information, and what kind of support are you thinking of providing? As of 12th of this month, 14 Japanese nationals in Indonesia died in the country. From the information that we have, in Indonesia, COVID-19 infection is rapidly spreading. And free of charge provision of vaccines is being made. A direct supply of vaccines is made into the country. Given these circumstances, those Japanese nationals living in Indonesia, many of them are expected to desire to come back to Japan. So to protect these nationals, those who wish to come back to Japan so that they can come back to Japan as quickly as possible, we need to develop the enabling environment for that, which I think is critical. Japanese airlines may fly special flights to Indonesia. Such arrangements and coordinations will be made as per necessary within the government. So there are individuals who are there as employees of corporations as well as individuals. So inclusive of their status, what would be the best way to evacuate or to transport these nationals, we're thinking. And how can we secure the accommodation facilities for these Japanese nationals coming back to Indonesia? We're also considering that as well. Further, the Indonesian government has made an announcement about instituting travel restrictions. Receiving this information so that Japanese nationals in Indonesia will not be excessively restricted in their travels, we have made a request to the Indonesian government. When not just for foreign nationals traveling outside of Indonesia, for foreign nationals who are coming to airports to fly outside of Indonesia, they are no longer necessary to show their passports and documents. Using charter flights, Japanese nationals, 867 nationals were flown back to Japan last year. Up until November last year, 12,000 nationals from 101 countries were supported in their evacuation. Inclusive of Indonesia, we would like to continue to provide a protection for the safety of the nationals and overseas, including others in Indonesia.
Tamura from Sankei newspaper, related to UNESCO. So concerning the workers from working in the Korean Peninsula from Japan, what is your view? Because forced labor based on the Japanese law, the Japanese government has said that this was legal, and so it does not mean that forced labor was actually done. So does your position remain unchanged? It remains unchanged.
This is a question regarding Japan and France. On Saturday last week, in Tokyo, a French national in Japan who's prevented from seeing his children started a hunger strike. On that issue, the Japanese government and the French government, are you exchanging information between each other or started any arrangements? With respect to an individual, a civil case, MOFA is not in a position to make any specific comments. Upon saying so, let me say the following. So with respect to this issue over children's custody, regardless of whether it's a foreign national or a Japanese national, as per necessary, such case should be assisted by professionals, including lawyers, and the parties, direct parties, should work to resolve the issue themselves.
Now, concerning this issue, they are not divorced yet. So the father, he still has custody of the child, but still, he cannot see his child. And not only that, he does not even know whether or not the child is alive or not. He doesn't have such information. So the French government, to the Japanese government, made procedures in order to gain information. However, there is no response. And it's not only that. There are many similar cases. So, sorry, we will confirm. So I would like to ask for your comment. Let me confirm. So did you confirm the French government? Yes, French government. Directly you confirmed the French government? Yes. Through the embassy. There were various procedures done, we hear. And in the United Nations as well, the procedures are underway, and the lawyers have said that as well. I understand. So I would like to hear the comments from the Japanese government. So as Minister of Foreign Affairs, concerning the individual civil cases, we are not in a position to comment.
Fukuda-san, go ahead. Fukuda from Yomiuri newspaper. I have a question regarding vaccination certificate. Starting from the 26th, you will start receiving applications for the certificate. And what are the advantages for travelers using the certificate? because of reasons including allergy, there are those who will not be able to have vaccination. What kind of care are you planning to provide to such people? For those who are vaccinated, the fact that they were vaccinated could be certified in a public certificate. And once a certificate is issued, and by presenting the certificate to a country overseas, the receiving country will be able to use this certificate in making a decision for allowing travel within their country. And I think that there will be an international trend to facilitate this using certificates. Whatever the country or the region, with a vaccination certificate as to what kind of relaxation of restrictions and exemptions are granted. I think that's been coordinated. Each country is considering that. And the latest information will be uploaded on MOFA's website going forward on this. Because one does not have a vaccination certificate, will one be prohibited from making overseas travels? That is not the case from what I understand. But because of various circumstances, there are those who are not able to receive vaccination. In lieu of vaccination, one can take a PCR test to have their negative results proven. There are various measures that countries can take for such people who are not able to take vaccination. And so such information included, we would like to post information, latest information on our website.
Sushiro speaking from JIEF Economics. This is related to the question from Nikkei journalist. In Indonesia, Japanese, as well as the local medical institutions, I think there are collaborations with them. So for the government or for the embassy, there should be some medical collaboration. I don't quite understand your question. So for the Japanese residing overseas, the medical institutions, I think there is local environment allowing for medical treatment. So there should be relations between the company and the hospital locally. So the government or the embassy, we'd like to confirm whether such collaboration is possible. No, I don't understand your question. So please ask the administrative staff.
I have a question regarding border control. On the 9th last month, people traveling from certain countries, their 3-day quarantine requirement was lifted. But now Delta variant is raging in increasing number of countries. In France, Delta variant account for more than 50% of the new infections. Given that, the requirement of 3-day quarantine that is lifted, do you think you will need to reinstitute the requirement as government with respect to the spread of the infection by the variant? We're having a strong sense of crisis as we try to respond to this. In the quarantine facilities or accommodation facilities, a certain period of quarantine is required for 3 days, 6 days, and 10 days. We have multi-layered quarantine measures in place. So what is the degree of the spread of this variant? Of course, that is an important question, but at the same time, the overall number of COVID-19 infections, and of late, in airport testing, there are those who are proven positive. And so how many are such cases? We will take an overall look and make an overall judgment. And if necessary, we will take additional emergency measures in a timely and appropriate fashion. If there are no further questions, we would like to wrap up the press conference for the day. Thank you.